Well, we want to let viewers know that our next segment is about breast augmentation. We will be showing before and after photographs. Over the years on the program, we have covered cosmetic reconstruction post-mastectomy for those who have lost a breast due to cancer. Today, in our ongoing series on plastic surgery, we are looking at cosmetic augmentation. Leanne.
Yes, breast augmentation is the most common cosmetic surgery performed in this country. Dr. James Lacey of Kanata Plastic and Cosmetic Surgery has been performing these procedures for about 20 years. I have to share with viewers, though, you were the second youngest graduate from the plastic surgery program in Canada.
It's true.
And it's great because when you're a plastic surgeon, you always get to be the youngest, right? So Dr. Lacey is here, and we're not chatting about something that's funny. So many women choose breast augmentation or breast reduction for so many different reasons, and we're starting this segment with a reduction because, as you've said, it can be debilitating.
Absolutely. So we have an 18-year-old young lady here, and she does not feel like a young lady. She can't exercise, she doesn't feel attractive, tough to get a boyfriend, all those things. In fact, she has rash between her breasts, not just under her breasts. So with a breast reduction, we're able to achieve something smaller, natural, attractive. And in some cases, patients will even pay privately for this surgery rather than wait a couple of years for OHIP to provide it.
And this is the same patient, but a side view.
That's right. So on the profile view, we can see the large breast. And then on the after shot, you can see the natural looking breast with the higher nipple and a much more comfortable size.
Now, I've often heard from women who've nursed a number of children that their breasts are not the same. I don't know if that is the exact situation for our next patient.
Yes, this is a nursing mother, nursed 2 children. She's very, very deflated. You can see the stretch marks from when she breastfed. As well, you can see her right nipple is lower than the left. So in fact, here I did a bilateral augmentation. I used different size implants actually and different techniques. There's a vertical technique on the right to lift this nipple higher. And then on the left, there's actually a peri-areola technique to tighten the skin there.
And where is the main incision, Dr. Lacey?
The main incision was around the nipple here and a vertical here. And so here's the vertical, and then the circumareola is blocked.
And the last image that we just kind of teased you with was the image of this same patient in a bra.
That's right. So when you take those nice after procedure breasts and you put them in a bra, you get something very natural and attractive.
Natural and attractive, which leads us to how the techniques have changed, how the technology has changed, and we have to freely admit that when we are on a beach, and even in casual conversation, people say, are they real? Mm-hmm. This man has the eye. The rest, in case you're wondering, yes, they are real. But these are the 2 prototypes that you've brought along so that we understand what is going on in terms of the implant procedure.
So should you wish to change yours, Leanne,
this is as voluptuous as I've ever been, Dr. Lacey. I probably ever will be.
We have the choice of high profile, which gives a nice rounded look. And 4 out of 5 women will choose this implant because it gives something round, still natural, but nice and full. For someone who really wants a traditional breast, this is the flat slope on the upper pole and then a nicely projected nipple. This is about 1 in 5 women choose this implant.
Very interesting, though, because you, over the 20 years, you've seen a change in what women want. And what dictates that?
Quite often technology. I started off using saline implants, which are just bags filled with water, and they ripple and they feel fake and they leak. We then moved to these shaped devices that give a natural breast, and then women changed by media. They wanted something more round, what I call the California look. And then we moved to these more projecting implants.
We are going to be back with some more before and afters because everyone loves a before and after. And I have to say, this segment is very much like a trip to the dentist, you know, where you feel like the dentist is always assessing your teeth. So we're just going to be back with Dr. James Lacey in a short while.